Hi everyone, my name is Madison and today I will be presenting on postpartum depression. This presentation will focus on understanding postpartum depression and exploring an evidence-based intervention, peer-delivered cognitive behavioral therapy, and its implications for patient care, nursing practice, and the healthcare system. What is postpartum depression? Postpartum depression is a type of psychotic depression that women experience after childbirth. It begins within the first month after childbirth and it can last weeks to months. Gaps and limitations. Some findings might not apply widely because the study is focused on particular groups. It did not track results over extended periods of time either. Peer-run programs can differ in how they are carried out, and over time, changes in delivery could affect impact. Looking ahead, studies need to check lasting effects across varied communities because the way these approaches work at larger scales remains unclear. Differences between care led by nurses versus peers deserve a closer look. The research question is, does peer-delivered cognitive behavioral therapy reduce depression sign severity to postpartum care? Using the PICO method, population stands for input in postpartum women. The intervention is peer-delivered cognitive behavioral therapy. The comparison is compared to standard postpartum care, and the outcome is reduced depression sign severity. The research design is a randomized controlled trial will be used because it lowers the risk of bias. It allows direct comparison between the intervention and control group and offers compelling proof of causality. Sampling plan. Approximately 73 postpartum women from community health clinics and hospital maternity units will be selected for the study. Nurse referrals, postpartum follow-up appointments, and educational brochures are given in healthcare facilities will all be used to identify participants. Women who screen positive for mild to moderate depression symptoms within 9 weeks of giving birth will be eligible for inclusion. Severe mental illnesses needing emergency specialized care are examples of exclusion criteria. Random assignments will be used to place participants in either the controlled group, standard care, or the intervention group, peer-delivered CBT. Obtaining consent. Before taking part in the study, informed consent will be obtained. The participants will be given detailed information about the study's objectives, methods, possible risks, and advantages, confidentiality protocols, and their freedom to discontinue participation at any moment without paying any fees. Before deciding to participate, participants will have the chance to ask questions and provide written consent, reason being to uphold moral principles and safeguard people's rights and autonomy. Methodology. The Edinburgh Postnatal Depression Scale, EDPS, a popular tool for measuring postpartum depression symptoms, will be the main validated assessment tool used to collect data. Prior to intervention, baseline data will be gathered, and after the CBT program is finished, post-intervention evaluations will be conducted. While the control group will receive standard postpartum care without any additional intervention, the intervention group will engage in organized peer-delivered CBT sessions for a predetermined amount of time, example, weekly sessions for like 4 to 6 weeks. The success of the intervention will be assessed by comparing changes in depression scores between the two groups by statistical analysis of quantitative data. Potential risks and harms. There may be a few hazards associated with taking part in the study, mainly emotional discomfort while talking about mental health issues. When thinking about their symptoms, some people can feel upset. Participants will have access to mental health resources such as counseling services and crisis support if necessary in order to manage these risks. The CBT sessions will also be led by qualified facilitators in a non-judgmental and positive setting. Participants will be informed that there are no repercussions if they decide to leave the study at any point. Potential implications Early and easy available therapy, such as peer-delivered cognitive behavioral therapy, can improve patients' overall quality of life, maternal-infant attachment, and mental health outcomes. The study highlights the critical role that nurses play in screening, detecting, and supporting women who are expecting postpartum depression, as well as in allowing their access to appropriate therapy. Peer-delivered CBT is one of the scalable and affordable therapies that the healthcare system can use to improve long-term care outcomes for women and children, lessen the demand on trained professionals, mental health services, and cut healthcare costs. These are my citations, and thank you for listening.